The Subcommittee on Health, Employment, Labor, and Pensions will come to order. I note that a quorum is present. Without objection, the chair is authorized to call a recess at any time. Thank you to our witnesses for joining the subcommittee to discuss today's topic, a healthy workforce, expanding access and affordability in employer-sponsored health care. As the Committee of Jurisdiction over Employer-Sponsored Health Care, Education and Workforce Committee members understand that employers want what is best for their employees. Despite not being required to offer health coverage, small businesses often choose to do so in order to attract and retain top talent. According to NFIB, 56% of small employers offer health insurance, and 89% of small businesses with more than 30 employees offer health benefits. As a small business owner myself, I learned that investing in the health of my employees paid long-term dividends, both in productivity and the morale of the company. Unfortunately, it's getting more challenging for businesses of all sizes to offer competitive health care benefits to their employees. I have often said that competition is the only way to bring down cost. According to the Kaiser Family Foundation, premiums for family coverage for employees have increased 7% in each of the last 2 years. Rising costs have a disproportionate impact on small businesses as they are less able to absorb the impacts of rising health care costs. 94% of small employers find it challenging to manage the cost of their health plans, and 98% believe that the cost of their health plans will become unsustainable within this decade. The Biden-Harris administration's inflationary agenda, intent on tying the hands of employers with costly and burdensome regulations, contributed to the health care cost challenges that small businesses face today. Fortunately, President Trump and House Republicans have common sense solutions to give small businesses flexibility to expand access and affordability to their health care offerings. The first solution is expanding access to associated health plans, or AHPs. An AHP allows employers to band together to purchase health coverage. By combining purchasing power, small employers can negotiate more favorable rates, the same way that larger employers do. In 2018, the Trump administration finalized a rule that expanded AHP availability to more businesses and to self-employed individuals. However, this rule was regrettably tied up in the courts and ultimately reversed by the Biden administration. The results speak for themselves. While the Trump rule was in effect, new AHPs produced savings of up to 29% on average, while realtor AHPs, like the one Mrs. Shields will speak about today, saw an average savings of up to 50%. Congress should ensure that AHPs are a viable option for small businesses and self-employed individuals for years to come, which is why it's important for Congress to pass Chairman Walberg's Association Health Plans Act. Businesses of all sizes can use stop-loss or reinsurance to insulate themselves from unexpected high medical claims. However, Democrat-led states have sought to overregulate self-insured health plans using reinsurance by artificially classifying these plans as fully insured, with the intended result of removing small businesses' ability to innovate and contain cost. Dr. Unruh's Self-Insurance Protection Act would clarify that self-insured plans with reinsurance are still self-insured health plans. As we hear in testimony today, the COVID-19 pandemic created an opportunity for small businesses to innovate by expanding telehealth coverage options. Chairman Walberg's Telehealth Benefit Expansion for Workers Act would return to employers this important tool used to expand coverage options and lower cost. Employers have also innovated by participating in direct contracts with providers, removing middlemen and bureaucracy, and allowing employers to customize their coverage options to meet their employees' health care needs. This hearing will examine expanding businesses' ability to use innovative coverage models like direct contracts. Lastly, this committee, on a bipartisan basis, has historically held ERISA preemption of state insurance law to be fundamentally important. ERISA preemption has allowed self-insured health plans the flexibility to design their plans in a way that works best for over 50 years. We look forward to closely working with the Department of Labor to defend ERISA preemption. I am hopeful that our Democratic colleagues will work with us to give businesses more options, more flexibility, and more opportunities to offer high-quality, affordable coverage to their employees. I thank the subcommittee members for joining this important discussion, and I look forward to our witnesses' expert testimony. Now I yield to the ranking member for an opening statement.
Thank you, Mr. Chairman. I want to thank you for having this hearing. As you know, as soon as we both knew we were going to have these assignments again, I reached out. We had a wonderful conversation, and as two former small business owners, or I'm a former, the gray hair and the white hair came from politics mostly. Well, no, owning restaurants probably was worse. So we've both met payrolls. We've paid for insurance. I want to really, and my hope is that while we go into our ideological approaches to this, there's an old saying, if you do what you've always done, you get what you've always got, that when we go through this, we could work in a way that seems to me to be completely bipartisan. How do we improve efficiently with performance standards the delivery of care and the cost to this marketplace? For you and I, as you stated, and for large employers, clearly, if you're a business owner, you want to get value out of your insurance, and you don't want to have high denials. You don't want to have your as you said, your employees not being as effective because they're not getting the support that they paid for. So my concern is what's happening to the marketplace in this field. The previous session, the previous chair and I, we had hearings on PBMs. What an inefficient part of the healthcare delivery system. We have stories now about private equity companies going in and buying out rural hospitals, taking out all the assets and leaving, and having emergency response people have to take people an hour and 15 minutes to the nearest hospital as opposed to 15 minutes. All of that is a structure that I don't know what the solution is. I have my own ideas, as you do, but it clearly, for me, is a level of urgency that this committee should really dive into. And my respect for you, Mr. Chairman, and our collegiality over the years, having been in the same class and our backgrounds, I think gives me hope that we can approach this in a way that we get good value for the employers, the employees, and the value includes the cost, but also the quality of care. And I don't think we're talking enough in this hearing, but hopefully in future ones, about the quality of care. And then secondarily, you know my passion about behavioral health and making sure people have that access. But we've also had hearings in the previous session, bipartisan hearings about denials. And the facts about denials are just outrageous. I've had doctors tell me all over the country that claims they put in routinely for decades, they're now being denied. And I have one example in my comments. So thank you for this. However, I've got to start out with a reality that in the last 3 months with the current administration and DOGE and Mr. Musk, they have done irreparable harm without analysis to the health and safety of American workers. And this is the next part. The reckless closure of key offices within the Department of Health and Human Services and firing of tens of thousands of essential workers is contrary to the administration's supposed enthusiasm for efficiency. You don't take years of experience in any operation, private or public, and just indiscriminately get rid of them. There's value that taxpayers lost by doing this. I'm fine with greater efficiency. We can always look at that, but efficiency also requires us to look at the current positive sides of the delivery of services. To me, that's the essence of owning a business, is problem solving without already assuming what the solutions are and being open-minded to how we achieve those solutions. The Administration of Community Living, or ACL, which is slated for closure, was formed specifically to streamline and bring under one umbrella the various programs in the Health and Human Services Department. I'd like to submit for the record a letter signed by more than 450 organizations expressing their dismay over the plan to eliminate the ACL and split its functions across 3 other agencies. I'd like to submit this, I'd like unanimous consent at this time to submit it for the record.
Without objection.
Thank you. Today, we could discuss ways to improve access to care through employer-sponsored insurance by addressing exorbitant prescription drug costs or unjustified claims denials by large insurance companies. These are challenges we should tackle in light of the fact that last year alone, 31 million Americans had to borrow an estimated $74 billion to pay for health care for themselves or a family member. Healthcare costs is the #1 reason for personal bankruptcy in the United States of America. That is completely unacceptable. Instead, against this backdrop, my congressional Republican colleagues are working to cut Medicaid based on their budget decisions to pay for tax cuts for billionaires and corporations. While we could partner on efforts to expand coverage for all Americans, including through employer-sponsored insurance, my colleagues, unfortunately, in my opinion, are pressing forward on efforts to eliminate health coverage and make health care costs skyrocket for many people without an analysis of the quality of care. In February, the House majority approved a budget resolution that would give tax cuts to the rich at 1% with a price tag of over $1.1 trillion. To help pay for this, Republicans directed the House Energy and Commerce Committee to cut $880 billion. The Nonpartisan Congressional Budget Office, CBO, reported last month that there is no way for the majority party to meet their targeted cuts without forcing the most significant cuts to Medicaid in American history. I'd like to enter this report into the record, and I ask unanimous consent to do so.
Without objection.
I might add that the CBO also did a report on the tax cuts, and their analysis showed that over 85% of the benefits did not trickle down to Americans. It went to the top 1%. So in an age where we have the highest concentration of wealth in the history of the country, this tax cut actually made it worse. That's according to the CBO. I challenge my colleagues from across the aisle to hold town halls and listen to what their constituents say. I've had 4 in 3 months. Say about how much they rely on Medicaid. Constituents like Elisa Rizzio, who lives in my district, I'm proud to represent, and is a parent to children with disabilities. She would be irreparably harmed, and her children, by reckless cuts to Medicaid. 1 in 5 Americans are covered by Medicaid, and they're understandably furious and afraid that their health is being sacrificed to pay for billionaires' tax cuts. Our priorities have never been clearer. Republicans are fighting to slash Medicaid for millions of people. I hope they change their mind, and I hope their constituents are telling them not to do that. And raise taxes for consumers in ACA plans, and dismantle federal agencies that combat corporate greed, all in order to fund $4.5 trillion in tax cuts for billionaires and large corporations. And also, they've just cut the National Institute for Health, including serious cuts to the American Cancer Institute, which we'll talk about further with Ms. Lilly. On the other hand, Democrats have solutions to take on big pharma insurance companies and large corporations, and not all of them. We support corporations that have social responsibility and want to work with us and expect a profit from those contributions and their efficiencies. But unfortunately, too many corporations are driving to the lowest common denominator in terms of return on investment without any kind of long-term strategy for the quality of the product they offer. Last week, we celebrated the 15th anniversary of the Affordable Care Act, which dramatically expanded millions of Americans' access to affordable health care. Congressional Democrats continue to build on this progress with the American Rescue Plan Act and the Inflation Reduction Act. Much more work needs to be done to improve health care in this country and make it more affordable. However, axing the services and coverage that so many Americans rely on is not the way to accomplish those goals. I look forward to us working together to increase efficiency and the quality of care in our healthcare system. Nothing, I think, should be more bipartisan, in spite of our differences of our approach, in order to extend people's lives and the quality of lives for all Americans, irrespective of where they live or what their party affiliation is. Thank you, Mr. Chairman. I yield back.
Thank you, Mr. Sonnier. Pursuant to Committee Rule 8C, all members who wish to insert written statements into the record Oh, sorry. And without objection, the hearing record will remain open for 14 days to allow such statements and other extraneous materials noted during the hearing to be submitted for the official hearing record. Now I would like to introduce our witnesses. I will now turn to the introduction of our three distinguished witnesses. Our first witness is Ms. Angela Shields, the Chief Executive Officer for Tennessee Realtors in Nashville, Tennessee, a great state and a great city. Mrs. Shields is testifying on behalf of the National Association of Realtors. Our second witness is Ms. Bethany Lilly, the Executive Director for Public Policy at the Leukemia and Lymphoma Society in Washington, D.C. Our last witness is Ms. Marcie Strouse, a partner with Capital Benefits Group in Des Moines, Iowa. Mrs. Strouse is testifying on behalf of the National Federation of Independent Businesses. We thank the witnesses for being here today, and we look forward to your testimony. Pursuant to committee rules, I would ask that you each limit your oral presentation to a three-minute summary of your written statement. The clock will count down for 3 minutes as committee members have many questions for you, and we would like to spend as much time as possible on those questions. Pursuant to Committee Rule 8D and committee practice, however, we will not cut off your testimony until you reach the 5-minute mark. I would also like to remind the witnesses to be aware of their responsibility to provide accurate information to the subcommittee. I will first recognize Mrs. Shields for your opening statement.
Thank you, Chairman Allen, Ranking Member Desane, and members of the subcommittee. Thank you for the opportunity to testify on behalf of the National Association of Realtors. My name is Angela Shields, and I am CEO for the Tennessee Realtors. In 2019, Tennessee and other realtor associations created an association health plan to provide high-quality, low-cost health coverage options to our members. We succeeded. Realtor AHPs offered comprehensive health coverage for pre-existing conditions and all 10 ACA essential health benefits. Our AHPs also had lower deductibles and broader provider networks than the ACA. We did not negatively affect the ACA markets. Our members are generally older, and most don't obtain their health insurance from the ACA, so there was no competition. Of the few who did leave the ACA, most were older, less healthy individuals seeking the lower deductibles and broader networks our AHP offered. Unfortunately, a federal district court overturned the regulation allowing our associations to offer the AHP, forcing us to discontinue our plan. We were devastated. My leadership team and I care deeply about our members and their families. For the past 5 years, I have fielded hundreds of calls and emails from members, many with serious pre-existing conditions. I had to explain why we took away their affordable comprehensive health care plans. Chairman Wahlberg has introduced the Association Health Plan Act, which would allow our realtor associations to once again have comprehensive and affordable coverage. We support this bill because it provides a choice which allows self-employed individuals and small businesses to shop around and decide which works best, the ACA or AHPs. I would like to end by saying this. The ACA has helped many of our members, and we will continue to support the ACA. But high deductibles and limited networks make the ACA unworkable for most NAR members. AHP health coverages offers a viable insurance option for those members who find the ACA does not work. We urge Congress to work together and build on the AHP Act to provide a choice to self-employed individuals and to small businesses. Once again, I'd like to thank you for your time and your consideration, and I'll be happy to answer any questions that you would like to ask.
Thank you, Mrs. Shields. I now recognize Mrs. Lilly for your testimony.
Thank you. And thank you for inviting me to be here today, Chairman Allen and Ranking Member Dusanier. It's also wonderful to see Chairman Wahlberg and Ranking Member Scott. I am delighted to join you today to talk about health insurance and how it does and does not work for patients with blood cancer. My name is Bethany Lilly, and I serve as the Executive Director of Public Policy at the Leukemia and Lymphoma Society, where our mission is to cure blood cancers and improve the quality of life for patients and for their families. No one knows when they or someone they love will be diagnosed with a blood cancer. But once a diagnosis occurs, our patients must often immediately start treatment. For some, every additional day of delay can reduce their chances of long-term survival. Unfortunately, this is often the moment when our patients discover that their insurance is far more limited than they expected it to be. The last thing anyone with cancer should have to think about while undergoing treatment is whether their insurance will or will not cover the health care that they need. It is also no longer tenable to ignore the unsustainable growth in the cost of care in this country. Regardless of whether someone has been diagnosed with cancer or not, the cost of health insurance is significantly impacting American pocketbooks. Costs that patients don't pay directly in copays or deductibles are too often passed back to them in the form of higher premiums. Insurance companies and public officials respond to efforts to reduce costs by inventing new ways to shift costs back onto the patients who receive care. Higher deductibles, additional non-covered care, more prior authorizations and denials, increased coinsurance, rising premiums, and more red tape. At LLS, we have focused on identifying ways to drive down the cost curve for blood cancer care without eroding the underlying quality of health insurance coverage, including policies mentioned in my written testimony that have been before the committee in this and previous Congresses. We are excited to work with the committee to address issues related to denials and appeals, to prevent anti-competitive contracting practices, to advance site-neutral reforms, and to limit facility fees. I would be remiss if I didn't mention two additional and deeply impactful issues related to coverage before Congress this year: the reauthorization of the ACA's enhanced premium tax credits and preserving access to the Medicaid program. LLS urges the Congress to take action to extend the tax credits that make ACA coverage more affordable. And similarly, we are deeply concerned about proposals to cut the Medicaid program that will result in coverage losses. Now is the time for policymakers to stand up for patients, survivors, and caregivers by advancing solutions that bend the cost curve without sacrificing patient care. We need bold action in order to make the system sustainable for patients today and in the future. And we need to ensure that every one of the approximately 188,000 people who will be diagnosed with a blood cancer this year and every year after that have access to comprehensive, high-quality, and affordable health coverage. Thank you all for your time and attention to these important issues today. LLS looks forward to working with all of you to improve healthcare coverage for blood cancer patients, and I look forward to taking your questions.
Chairman Allen, Ranking Member Desaulnier, and members of the subcommittee, thank you for the opportunity to testify today. My name is Marcie Strouse. I'm a small business owner and benefits consultant in Des Moines, Iowa, but more importantly, I'm a mom of 3 amazing kids, including twins who were diagnosed with a neuromuscular disease. That diagnosis turned my world upside down, and it changed how I see healthcare. It's not just policy issue for me, it's personal. It's about ensuring that people can access the care they need when it matters most. For over 20 years, I've worked directly with small employers across Iowa. I sit across from family-run businesses, hearing their fears and frustrations. They want to take care of their people, they want to be competitive, but they're drowning in rising costs and limited choices. In Polk County, where I live, family premiums for small group plans have gone up 85% in just 8 years. For my own family of 5, we pay $1,100 a month for a pre-ACA plan. A comparable ACA plan today would cost my family more than $2,100 a month, almost double. That's simply not sustainable, and I can tell you I'm not the exception. Most small business owners are feeling the strain of rising costs and thinking to themselves, how can we stay competitive, retain and attract employees, and support our teams when we're paying more for less coverage every day? According to the latest NFIB job survey, 38% of small employers couldn't fill open jobs this February. Offering health benefits is one of the only ways we can compete with big companies, but 94% of owners say it's getting harder to afford. So what can Congress do? Small business owners are resilient and innovative. They just need the tools to succeed. Congress should empower small businesses with more choices, greater flexibility, and better tools to support healthier teams and stronger communities. Pass the Self-Insurance Protection Act. Self-insurance gives small businesses the freedom to design smarter plans. Over the last 3 years, one of my two-person clients saved $17,500 by moving to a level-funded plan. Congress should protect small business access to vital tools like stop-loss insurance. Expand association health plans. Letting small businesses pool together, regardless of industry, levels the playing field with big employers and provides more options. Promoting innovative models such as direct primary care and reference-based pricing. I have employers that have saved over 40% by switching to a plan with DPC and reference-based pricing. The models lower costs and put consumers back in the driver's seat. Preserve and expand telehealth. Telehealth is a lifeline, especially in rural communities, and it saves time and money. Congress should pass the Telehealth Benefit Expansion for Workers Act to make this a permanent option under ERISA. Protect ERISA preemption and cut red tape. We need clear, uniform rules so we can focus on our people, not paperwork. Finally, promote transparency. Market consolidation and hidden costs have driven prices up. Small employers deserve to know what they're paying and why. We want to take care of our teams, offer strong benefits, and build businesses we can be proud of. But we need Washington to give us the tools to do that. I look forward to working with the committee to accomplish these goals. Thank you for the opportunity to testify today.
I will start with my questions first. And before I do, I'd like to clarify just a few things for the witnesses and for everyone attending the hearing today. First, at least in my meetings with Elon Musk and his team and our conference meetings, his team has no authority to hire and fire a single federal employee. What they are doing is what I would do in my business. They're going in, they're analyzing it, they're running algorithms, they're looking at production, how many people it should take, and what it takes to run the government. I would think that any organization would want someone to take a look at that. Unfortunately, Congress hadn't been able to do that, and that is seriously our responsibility, but for whatever reason, politics gets in the way. And so he's providing a very valuable service to this country, and I think we should be ashamed of demonizing somebody that actually wants to help us get out of a serious situation. The other thing I would say is this. There are two things that got to happen for us to sustain this country. First is we have to, and all the analysts say this, we have to reduce government spending by 3% and grow the GDP by 3%. If we don't do this, it's unsustainable. We have run $2 trillion deficits long after COVID. COVID's been over for 3 years, and we're still running $2 trillion deficit. That is unsustainable. No country can. Our interest on our debt is $1 trillion. The American people need to wake up to this fact. There is a way to deal with it. First, you have to have incentives. We have been told by analysts, if we don't pass and extend the tax credits, that there will be, we will lose incentives for businesses to grow their business and to hire more people. You have to have incentives to grow GDP. And so these are just business principles that I learned in my business, and I'm sure other folks who have learned in business. This is the way to do business. Now, Ms. Shields, getting back to you and self-employed individuals, like the realtors you represent that often struggle to find affordable health care coverage, what options do realtors have to obtain coverage?
Thank you, Mr. Chairman. My members, when we were offering our health care plan, they had some options available, obviously. They had the ACA. They did have our plan at the time that they no longer have. Many of them that were married were able to obtain through their spouse. And then frankly, we have 15% nationwide that are not insured at all. So that is our biggest concern. What we did find was that when we offered our plan, they were comparing our plan to the ACA. So some did stay in the ACA. The ones that we attracted were the ones that the ACA was just too expensive for them. They could not afford it. So we were able to save them some cost. They also found our deductibles were a little better, and so they made the change for that particular reason. And again, back to the spouses, they were able to save money sometimes because they were having to pay for their spouse that might not have been insured as well.
So why are AHPs so important for self-employed individuals like realtors?
Thank you again for that question. It's so important because for many reasons, and I could talk to you all day about it, but the ones I would highlight is, again, the deductible savings. Many cases, we are able to keep them with the doctors they're already using. We do take pre-existing conditions, and it just gives them good, high-quality coverage. We are a plan that was ACA compliant. We had all 10 of the key essential programs that is required by ACA. So we were offering them good coverage.
Yeah, and I can't understand why anybody would object to that. Ms. Strouse, small employers with fewer than 50 employees are not required to offer health coverage to their employees, but many choose to do so. Can you discuss the reasons why small employers choose to offer health coverage?
Yes, that's a great question and one that I get a lot. It's because they want to take care of their people. They want to take care of their communities. They want to be also competitive to the large employers that are out there. Right now, they pay twice as much as a large employer does for healthcare costs. However, they are employing the people that they see at church on Sundays, that they see on the soccer field. And so these are not just employees to them, they are their community. And so they want to make sure that they have that opportunity to provide benefits. And just as mentioned, you know, the ACA in Iowa specifically limits the access to network. So we only have HMO options within our marketplace in Iowa, which is like most states. So in order to offer a group plan, you have more flexibility and you can offer more of those national PPO networks that then have that broader network. So
Right.
people are not losing their coverage.
And you know, there was a promise made in the ACA that your premiums would go down. And what we've done is employer-based health insurance has become so expensive, it's actually driving people to Medicaid.
Yes.
Which is, you know, the problem we have with the mandatory spending issue. So if we can customize it, make it more affordable, obviously, we can get these people on great plans, and obviously the company has and the impact of this coverage, I mean, it's got to be positive. In other words, the idea is it's coming from the employer and not from the federal government. Would that be yeah?
Absolutely, yeah.
Your written testimony, and I've got about a minute, notes how innovative coverage models such as direct contracts and direct primary care allow businesses to lower cost and improve quality. What barriers do small employers face in using these innovative models, and what can Congress do to make it easier for small employers to use these models?
Yeah, so currently when you use direct primary care, there's a subscription or a membership fee that's included for access for those plans, and they are not HSA qualified. So if you have an FSA plan in or an HSA plan in, you don't receive those tax benefits on those plans. Direct primary care also has a huge impact on outcome of health care. So typically those employees that are using direct primary care have a much higher level of direct access to their provider. And so in the case of maybe diagnosing a chronic disease earlier, those things are going to be caught. So there's a lot more advocacy on that side of things. So that for me is a big piece of it, is just making sure that those employees and employers can afford to offer those direct primary care options.
Great. Thank you so much, and I'll yield my time now and recognize Mr. Courtney for your questions.
Thank you, Mr. Chairman, and thank you to the witnesses for your thoughtful testimony. Again, I'm also somebody who can say that I spent 20 years as a small employer, and like the chairman and the ranking member, you know, definitely acknowledge that there's realities there in terms of that end of the market that we should always be focused and working on. Last Congress, as Mr. Desaulnier mentioned, we actually came together on a bipartisan basis to have the transparency in the pharmacy benefit managers, which again, small business community supported strongly because that black box of how prescription drugs are negotiated is unacceptable in terms of really trying to make sure that the customer, which is businesses who are buying these health plans, understand where their dollars are going. And large companies like Boeing, as part of their contracts with PBMs, required full transparency. And because of that, a lot of them didn't bid on their offering. And but the ones that did, Boeing saved millions of dollars because of just the fact that they could be able to see what happened. Unfortunately, the bill was pulled during the lame duck session at the behest of the Trump transition team. And again, Speaker Johnson had signed off in terms of the legislation, and unfortunately it got withdrawn. We're going to start again because that's getting to the core costs of healthcare has got to be part of the plan here in terms of how you lower premiums. If you don't do that, then everything you're doing is just cost shifting. It's whack-a-mole, and that's just not going to work. And speaking of moles, Mr. Desaulnier mentioned the $880 billion cut to Medicaid, which is not a mole. That's like a gorilla that is going to, again, have ripple effects to the employer community. Mr. Chairman, I have a list of the 50 major healthcare provider groups that have come out opposed to the $880 billion cut. And again, it deals with the high-end providers, the American Hospital Association, Catholic Hospital Association, Children's Health Association, physician groups, patient groups that have all come forward and recognize the devastating impact this is going to have for access to care. And I ask that this list be unanimous consent to be added to the record.
Without objection.
So again, if that goes through, we're looking again at, a program that provides 40% of the live birth coverage in America for babies and mothers. Again, it's about 45% of children are covered. Some are actually working families because Medicaid provides for coverage. Again, Ms. Lilly, maybe you can talk about that that's part of the solution in terms of helping with employers to have options.
I will say, just to start off, that I think having cancer is incredibly expensive. Anyone in our community who has had cancer can tell you that. And for a lot of kids, as you said, Medicaid is either their source of coverage, or it comes in as a secondary source of coverage when their parents realize exactly how expensive this is going to be. Children's hospitals across the United States, I'm sure they're on your list because they are one of the largest recipients of Medicaid funding. So when our kids end up in these children's hospitals that have the necessary specialized care, Medicaid is often the program that is picking up the tab there. I will say, I also think a lot about caregivers. If you are, say, a mom or a dad who has had a kid diagnosed with cancer, and that kid is in the hospital for months or weeks on end, you may not be able to maintain your job. You may not have access to paid leave. You may not be able to do that. And so you also need health insurance. If something additionally awful were to happen, you would also need that health insurance, and Medicaid also picks up those families. Medicaid is also incredibly important for people with disabilities, and many people deal with the long-term implications of having a cancer. So for instance, I know you have personal experience with this, sir, but if you have been through that chemo, if you have been through that radiation, if you have been through, frankly, the treatments that we still need to develop better options for, those can have really long-term implications on your health, and you may need access to long-term services and supports, which are only available through the Medicaid program. And so really, Medicaid kind of comes around all cancer patients and really helps all of that. I will add that I think in addition to caregivers and kids and people with disabilities, you also have a lot of older adults on Medicaid, and that's actually one of the biggest populations of people with blood cancer are older adults.
Right. Thank you. I yield back.
Thank you, Mr. Chairman, and I want to say thank you to you and Ranking Member DeSaulnier for your flexibility in continuing this hearing today, starting a little earlier than we'd planned as the schedule's changed. But thank you. I think it's an important hearing. I would also say I look forward to the apologies that will come out from my Democrat colleagues when we find it all worked out that there were no Medicaid benefit cuts. The unfettered fear-mongering that's going on that people with cancer and everyone else are concerned with unnecessarily. I look forward to that and the conscious effort to try to declare before the American people that $880 billion of cuts, which will cut the entire Medicaid funding, is intended. So we'll see. I look forward to that when, in fact, the President and leadership in Congress have said no Medicaid cuts. I hope that gets out. Ms. Shields, thank you for being here. The Congressional Budget Office estimates that expanding association health plans will result in 400,000 uninsured individuals gaining coverage. What are additional advantages of allowing small businesses to band together to offer coverage through AHPs?
Thank you. Again, there's many benefits to allowing these programs. One, you do pick up additional people who had not been insured. We've had, not to repeat myself, but 15% that were uninsured across the entire nation with NAR, so we're picking them up. Secondly, we have a comprehensive plan that is offering great benefits to our members that they were otherwise unable to get. The cost savings, the deductible that is lower, and we were able to lower the deductibles for our members where they were paying for a family $11,000. We were able to bring that down significantly, anywhere from $4,000 to $6,000, depending on which plan they picked. And these are high-quality plans that were ACA compliant and had all 10 essential pieces in it. They're able to keep their doctors. We were allowing them to choose, these plans allowed them to choose their doctors. We also had where we were allowing pre-existing conditions. So it was everything that we were able to provide. It was as if you were going to work for a large employer, but it was a plan that they were able to do as self-employed, which for us, our job is to offer our members benefits, and this was one of the biggest benefits they were asking for.
Yeah. So the disruption of the Tennessee Realtors AHP ultimately put people on the Unaffordable Care Act again.
Absolutely,
Most-
or uninsured.
Or uninsured, which was basically the same in many cases. You had an insurance policy on the Unaffordable Care Act, but you couldn't use it in so many cases.
Right. We heard terrible stories from members, particularly when we had to tell them that we had to cancel the program. I had a member who unfortunately has passed since that time, who had everything from heart conditions to diabetes and ended up dying from Lou Gehrig's disease. Yeah. So to have to tell somebody like that we finally got you on a plan, and then have to tell him, we're so sorry, but now we have to take it away.
Yeah, the cruelty of the courts and the Biden administration in taking people off a plan that worked for them, which provides insurance coverage when you figure across the nation for 85% potentially of our workforce in small business. Thank you.
Thank you.
Ms. Strouse, use of telehealth drastically increased during the pandemic, and as a result, we saw new and innovative ways of delivering care. What feedback did you receive from workers about increased access to telehealth benefits?
Yeah, the telehealth benefit was actually pretty significant during that time. And then going forward, people got used to it and the access to care through telehealth. And so for us, what we saw in the state of Iowa was more access to behavioral health providers during that time because like Iowa, like many states, have challenges with providers and access to providers, especially in rural communities like Iowa has. And so that telehealth piece actually helps to keep people from running into the doctor for things and incurring a cost, a claims cost to that. A lot of these things can be done at no cost to the employee, depending on plans and how these are set up. So what also happened was it actually encouraged people to actually seek that care because maybe that barrier of getting in to see a provider face-to-face is gone. So telehealth is very significant. We'd love to see that continue forward, especially on the health savings accounts qualified plans.
Right, which saves costs as well and helps healthcare. Thank you.
Absolutely.
I yield back.
The chairman yields back. The chair next recognizes Ms. Lee from Pennsylvania.
Thank you, Mr. Chair. I think I might take just a slightly different route, and I would like to start by saying that I don't think that we should have healthcare that's tied to employment in the first place. The United States has the largest economy on earth, but we are one of the only wealthy countries where getting sick can bankrupt you, and your access to care depends on what kind of job you have, or whether you have one at all. Our current healthcare system tells people that their worth and their health depends on their specific employment status. In the wake of the Trump administration and DOJ's reckless mass firings across the federal government, it's now clearer than ever why tying something as essential as healthcare to a paycheck is harmful. We're hearing heartbreaking stories after heartbreaking story about the tens of thousands of people who are waking up one day suddenly unemployed and also suddenly without health care. A woman about to give birth to twins, a man in the middle of chemotherapy. We've heard from a senior desperately needing hip surgery. But let's also not forget, even those with employer-sponsored insurance can still struggle with healthcare access and affordability. Often I hear from working families who are underinsured, burdened by high out-of-pocket costs, skipping appointments, or drowning in debt for care that barely meets their needs. If they even have coverage, it often doesn't go far enough, and many are forced to choose between rent or groceries or paying thousands for their life-saving medication. Ms. Lilly, based on what you've seen in the blood cancer community, can you speak to the personal and financial effects on patients when they're denied coverage for life-saving care, not because of medical judgment, but because it's deemed too costly or not profitable?
Yeah, so I would say that this is unfortunately a call we often get to our information and referral center is, hi, I have insurance, but they're saying they're not going to cover this particular service. Unfortunately, the U.S. has led in biomedical research. We have amazing cell and gene therapies, and those therapies are probably the calls we get the most now, is folks being unable to access these services because they are so expensive. I'll also add that this is one of the reasons why Medicaid is so important. If we look at Deanne, who was diagnosed with blood cancer many years ago, she ended up on Medicaid because she could no longer work. Similar situation for Amanda, who lives in Michigan. Many of our patients end up not being able to work, not being able to maintain the coverage, and then end up accessing the Medicaid program because they are literally too sick to work.
Thank you. So unfortunately, being denied life-saving care based on cost isn't an exception. It's baked into the system. Investigations have uncovered troubling practices by health plans and their corporate service providers to conduct arbitrary, improper, and mass denials of claims. A ProPublica investigation found that Cigna built a system allowing doctors to instantly reject claims without opening the patient's file. Another investigation found how EVCor, a company contracted by insurers that cover over 100 million Americans, uses a secretive algorithm to drive up denial rates. One employee described executives directing staff to keep a closer eye on guidelines because we're not showing savings. Ms. Lilly, since private insurers often have a duty to maximize profit for shareholders, would you agree that a health system designed to maximize care and access for the public would help prevent these kinds of abusive denial practices and better protect patients?
I think it would, and I think having that transparency that has really been a theme of this hearing so far around what algorithms are being used, what are they based on, are they being double-checked, is there a human actually reading the results and saying, okay, no, this is all right, this makes sense. Does that human have the right expertise? Are they, if for my patients, an oncologist, or are they someone else?
And just to say, I think that this is exactly why we need universal health care. We've spent decades trying to patch a broken system. The Affordable Care Act expanded access and curbed some of the worst abuses, but to be honest, It was a compromise. And since then, both Democratic and Republican administrations have doubled down on market-based models that hand over more power and profit to corporate actors, allowing private equity firms and hospital conglomerates to tighten their grips on the healthcare system. And where do these profits go? Straight into lobbying and political campaigns that block meaningful reform. That's exactly why we know this Republican Congress, this administration, and the billionaires and corporate lackeys won't support the policies working people actually need. That's why instead of seeking to bolster our health system, they're seeking to cut at least $800 million in funding for Medicaid, a life-saving program for our most vulnerable populations, including those who found themselves or find themselves recently unemployed. We don't need more tweaks. We need a system that treats healthcare as a human right, not a job perk, one that prioritizes savings, lives, not shareholder values. We deserve universal, guaranteed healthcare for all. I thank you all so much for your time today, and I yield back.
The gentle lady yields back. The chair next recognizes himself for 5 minutes. You know, we've been hearing a lot today about Medicaid. That was not the purpose of this hearing, but I'd like to echo the sentiments of Chairman Walberg. Our Democrat colleagues insist on repeating their misrepresentations about Medicaid. There are no Medicaid cuts. Where do they get the $880 billion figure they keep repeating? They get that because that's the total amount that the Energy and Commerce Committee is tasked with savings as we desperately attempt to get our federal budget deficit and debt under control. Not all of that savings will come, of course, from the Medicaid program. Much of it will come from the EV mandate and so on. But even if $800 billion came from savings from reforming Medicaid, according to the CBO, instead of Medicaid spending over the next decade increasing by $2.5 trillion, it would increase by $1.7 trillion. Only in this city, only in Washington, D.C., is a $1.7 trillion increase a cut. But in many ways, there are many ways, without cutting coverage, that we can save money on the Medicaid program, and we do badly need to do so. We can check eligibility. That alone can save hundreds of billions of dollars. Work requirements can save over $100 billion. We know that Democrat states spend twice as much per capita on Medicaid as Republican states. We could reform gimmicks used by states to juice their take from the Medicaid dollar. And we can eliminate some of these gimmicks. No, there are no Medicaid cuts, but if we are to preserve Medicaid for the most needy and the most vulnerable, we badly need to reform the Medicaid program. Ms. Strouse, I appreciated your testimony in support of the Self-Insurance Protection Act. Self-insurance allows employers to offer an alternative to costly one-size-fits-all traditional insurance plans and Obamacare plans. It can produce long-term financial savings for employers, give flexibility to tailor coverage to the needs of their employees, and invest in employee wellness programs. Reinsurance or stop-loss insurance, which empowers self-insured employers to enter into these agreements, is critical. Reinsurance is a financial risk management tool that protects self-insured employers from catastrophic expenses. We know that in 2022, 103 million Americans relied on self-insurance for their health care coverage. But since the Obama administration, this alternative has been under attack at the state and federal levels. That is why this week, of course, I introduced the Self-Insurance Protection Act. This bill will protect self-insurance by clarifying that federal regulators cannot define stop-loss insurance as traditional health insurance, which common sense dictates it is not. It also prohibits states from regulating stop-loss insurance if those regulations make it inaccessible to employers. Essentially prevents the regulation of self-insurance out of business. Ms. Strouse, in your written testimony, you mentioned that a two-employee small business was able to save over $3,500 annually by transitioning to a level-funded plan by purchasing stop-loss insurance. How does this work, and how does this lead to cost savings?
Yeah, so Again, through innovation, what we're seeing here is new opportunities coming to the table. And so when you look at the small group market, that self-funded space is a little different than it would be for these large employers that, essentially are hundreds of employees. And so there are a lot more protections built around the small employers. So then that way, if for some reason they come into a self-funded plan and let's say they do have situations where they have multiple employees dealing with cancer or chronic diseases that might increase those costs, they still have protections so there's no run out, there's nothing that's going to catch them on the back end. So these have really been put together to make sure that it not only protects those employers and employees, but it does also put them in the driver's seat for their health care. So these plans, typically what they can do is lower deductibles, out-of-pocket maximums, lower those cost shares for office visits, but it also, again, gives those employees the opportunity to drive their own health experience and their own health journey. When you have skin in the game and it directly impacts your paycheck, you tend to be a little bit more engaged with what's going on. So we are seeing, things being diagnosed a lot sooner and better outcomes for employees in these situations.
Well, thank you, Ms. Strouse. I yield back. The chair recognizes Ranking Member Scott of Virginia.
Thank you, Mr. Chairman. Mr. Chairman, we've heard a lot about the deficit. I'll just point out that the Republican budget increases the deficit and adds on to the debt as opposed to compared to doing nothing. And remind people that every Democratic president since Kennedy has improved the deficit that they inherited compared to what they handed over to the Republicans. Every Republican president since Nixon has handed over to the Democrats a worse deficit than the one they inherited, all without exception. And for fear-mongering, the CBO said you can't cut energy and commerce $880 billion, programs under that committee, without touching Medicaid. If they want to end the fear-mongering, all they have to do is identify $880 billion within the jurisdiction of that committee that does not include Medicaid, and that would put an end to the discussion. Ms. Shield, you indicated that under your plans, you covered all of the essential benefits that were required under the Affordable Care Act. Is that right?
Yes, sir.
But that's not required for associated health plans. Is that right?
We made a point of making sure that we were covering everything, so that we
right.
wanted to be, we wanted to be
But
reputable.
it was not required under associated health plans.
I honestly would have to defer that to my consultant, so I could
Your
get back to you on
plans,
that.
it's not required under associated health plans, but you did voluntarily. Now, your plans were done before the American Rescue Plan Act eliminated the cliff at 4 times poverty, that eliminated any subsidies after, I guess, about $60,000 income for an individual. When we eliminated that cliff, what did that do to the competitiveness of your plans?
Congressman Scott, I'm not sure that I have the information to be able to answer that.
What was the typical policy premium under your plan?
The typical, again, they had several plans that they could pick from, so it might range $1,200 a month, depending on if they were getting family added to it. It might add just a little bit more to it, but I'm going to say average, they were probably around $1,000 to $1,100, $1,200, depending on which plan they picked.
So that'd be over $10,000, $12,000 a year. When we eliminated the cliff, it meant that the maximum you would pay for a family policy would be 8.5% of your income, which at $100,000 would be $8,500, which would be very difficult for you to compete with. I think the problem we had was that cliff, which we eliminated in the American Rescue Plan and extended in the Inflation Reduction Act, which made insurance much more affordable for the people in the income range that realtors would probably find themselves in. The 60 to 100,000, maybe a little more, would be much more affordable. Could businesses buy into the Affordable Care Act? Ms. Shield?
Again, I'm not familiar with the Affordable Care Act and as far as could businesses buy in, but I'm happy to get the information that you need and get that
Anybody on the
back to
panel
you.
answer that? Ms.
Can you just
Strauss?
repeat it real quick so I can make sure I'm understanding it?
Can businesses buy into, small businesses buy into the Affordable Care Act?
Yes.
And how does that work? Because we understand most businesses don't take advantage of that.
So there was the shop market opportunity, and it was not sustainable in most situations. And so what was happening was employers were looking at that as an option and recognizing that they had better options outside of that. Those subsidies that have been increased, some of these people that have coming from employer plans to get into the marketplace with those subsidies are recognizing that in that case, they actually have less access to providers in the marketplace, so they're giving something up to get lower premiums. The premiums have significantly increased from the very beginning of the marketplace.
Mr. Chairman, Mr. Shields indicated that the benefits, essential benefits were not required. I ask unanimous consent to enter into the record a Washington Post article entitled, "He had short-term health insurance. His colonoscopy cost him $7,000 because it was not included." Also, a statement on behalf of members of a partnership, a coalition of organizations who are opposing the Association Health Plans, the telehealth benefit expansion, and the Self-Insurance Protection Act, for the record.
Without objection, so ordered. The chair recognizes Mr. McKenzie of Pennsylvania.
Thank you, Mr. Chair. For Ms. Shields, participants in your program had a choice to enter into these plans. Is that correct?
That's correct. They would do their research to determine if our plan fit them best or if they wanted to go to the ACA or anywhere else.
And what they experienced was lower premiums and deductibles in this option.
That's correct. They had better prices, lower deductibles, and as pointed out earlier, it may not be necessarily that the price was lower, but they had a better plan that fit their needs.
And so what you're saying is that they were satisfied with their access to the care through these programs?
Absolutely, especially the fact that they were able to come in. We covered the previous existing conditions that they had, or that they were able to keep their doctors, or for whatever the necessary reason was.
So what I'm hearing is that this is a choice that these individuals are choosing. They were potentially able to get lower premiums and deductibles, and they were satisfied with the care that they were receiving.
100%. Our whole point was to offer it as a benefit so that they had options, because many of them, again, were not insured and didn't feel that they had anywhere that they could get the insurance that they needed.
So when you see that pattern, it is astounding that people would be opposed to giving people a choice to get lower cost health care that they are satisfied with. That is astounding to me, that somebody would go on the record and say, I want to take away choice from people to get low cost health care that meets their needs. I'll just leave it right there. So the next thing is I want to talk to Ms. Strouse and ask about small businesses, a particularly challenging environment for healthcare in our economy today is making sure that small businesses can offer affordable healthcare to their individuals. Can you tell me about additional innovative options that you're seeing in this space that meet those needs?
Yeah, so we routinely talk about the level funded, which is the self-funded plans in that small group market with most of our groups. So there's a little bit more flexibility in that. However, there are things coming into the market around direct primary care that actually, again, puts those employees in the driver's seat. So we have a program that we can offer to employers at a minimum, just a minimal fee on a monthly basis, and employees have direct access to a provider team that they can call, text, email at any time. This team not only advocates for them in situations where maybe a claim has been denied, which agents do all the time, and I just had one of those this week, so sometimes those denied claims are lack of documentation that needs to just be put together. But when we look at these things, the whole experience, which I think Mr. Desaulniers had mentioned, the quality of care is very challenging. A lot of times somebody might get diagnosed with something and just accessing the next step is very difficult. When you have these advocacy programs in place, you actually have a team that is not only helping you to navigate that process, a lot of times they have success in getting appointments sooner for these people. They have the ability to look at prescriptions, and so they can look at a wide variety of prescriptions in case somebody got prescribed something that's very expensive or not covered. They can do that medical management with them. And they also just have a little bit more of a person in their corner. So they know that they can contact this provider team, and that team already knows them, they know their family members, and they don't have to take the time out to go to a doctor that they might only see for 15 minutes to then be sent to a specialist or just out into the healthcare system. And so, again, these are providing that really high level of touch to the employees, and it is bringing the claims costs down because these programs do not run then through the insurance program. So for these basic needs that they have, those claims don't run through. And so when you partner that with a level funded plan or a high deductible health plan, the out-of-pocket costs go down significantly for those members that are participating in that.
Great. Well, thank you for sharing that with me. What I would like to close on is that we know we have a broken healthcare system in this country. I think everybody up here agrees with that. So the question is, where do you go next? And for me, the clear answer is that we want people to innovate. We want new options, more options available for these individuals. It could be association health plans. It could be self-insurance. It could be telehealth. It could be direct primary care. It could be anything that we are not even aware of at this time. But the way that we are going to get those solutions is by getting government out of the way. Instead of having a one-size-fits-all approach, which is failing people in many instances, I think we need to allow the free market to innovate, allow these new options to come online, and they can work in tandem with things like Medicare. It's not, or Medicaid. It is not a one-size-fits-all option. I think we need an all-of-the-above solution here. And so I, again, thank you for your testimony today and these new alternatives that you have presented that I think we should be in support of. Thank you, and I yield back.
The gentleman yields and now recognize Mr. Desaulniers, our ranking member, for his questions for 5 minutes.
Thank you, Mr. Chairman. I hope we're still friends. And the comments that have been made by my colleagues about Medicaid, I welcome. We can stop talking about it if we all have an agreement that what's in the Republican-approved budget in terms of the number is not going to happen the way it's described in that. So I think apologies are not the right word for my friend, Mr. Wahlberg. I think there's a recognition that the end product hopefully will be what we can all agree on, much like the starting product was from the Senate and through the budget process until a certain point where we're reaching consensus. Ms. Lilly, I am a survivor of stage 4 chronic lymphocytic leukemia. I like to tell my friends that I was perfectly healthy until I became a member of Congress when I was diagnosed with stage 4 cancer. And then after that, because of my decreased immune system, just running on the mall, I took a freak fall 5 years ago at the beginning of COVID, was rushed to George Washington, and my doctors there told my kids when they flew out from California that I would die in the next 48 hours. So I have some expertise, not because I chose to, but because I'm a survivor of the American healthcare system. And we do agree that the United States we pay the most of any developed country for our healthcare, a fifth of the economy, looking at people who help pay for that and from a business perspective. Clearly this is broken, and we have the worst outcomes of any developed country. I mean, that's a simple statement. If I ran a restaurant, I was losing money, and I kept borrowing money to prop it up, I wouldn't be in business very long. And also, if I said I was going to cut my prices by 25%, and I was also going to cut a third of my kitchen staff, I don't think people would believe me. So, Ms. Lilly, denials first, then I want to talk about the cuts at NIH and ACI. I've got an example that's not an anomaly, where a gentleman, and again, as a consumer, I could not have done this without help. As you have said, Mr. Strouse, and having been a small business member, and I was a member of NFIB back when I was a Republican many years ago. I can barely remember sometimes. So trying to negotiate that, so there's denials, and as you alluded to, there's the denials before the denials, just trying to negotiate the system, which isn't just conspiracies or incompetence. I had a friend who used to say, I used to believe in conspiracies until I discovered incompetence. In this instance, I think it was a combination of both that you alluded to. But in the case of denials, one case that stands out to me is a gentleman named Tracy Pike from Illinois, father of 3, he had stomach cancer, stage 4. He had been, all kinds of cases of precedents in let's see, Blue Shield of Illinois and Blue Cross of approving the operation. And then when he was getting ready to go, they denied the approval. He died because he was denied. Is that an anomaly, or is that what we're seeing more and more?
Unfortunately, it is not. I think it's something that we're seeing more and more as the cost of healthcare is increasing. And I'll add that, I think we testified before the ERISA Advisory Committee on this exact issue around denials recently, and that's part of my written testimony, so I'd refer everyone to that. But I will say, I think we don't know how many denials occur in employer-sponsored insurance. We don't have a lot of information, and that transparency is kind of the first step in that direction. The Office of Inspector General has looked at denials in both Medicaid managed care and in Medicare Advantage, where they are incredibly high. Folks don't know they can appeal denials. I mean, I think that the lack of consumer knowledge is also an incredibly important piece of this. Kaiser Family Foundation, KFF, does sponsor a regular survey of health consumers, and more than 50% of people had no idea they could appeal a denial.
I want to ask you about the cuts to NIH and ACI. As a survivor of leukemia, I wouldn't be here if it wasn't for investments over the last 70 years in research in the Department of Defense, first off, and at NIH and ACI. What is going to happen? Chronic CLL is the most common leukemia, affects everyone. Doctor told me if I was diagnosed with this 15 years ago, I'd be dead. Now I have a normal life expectancy times hundreds of thousands of Americans. What will these cuts that the administration's just done to the department and NIH, how will that affect life expectancy?
Half of cancer treatments in use today were developed by the NCI, the National Institute of Cancer. We need that research to advance the ball, to make sure that we have new treatments. And with cuts to that, we don't know. America has led in biomedical research for decades and decades. And that's why, sir, you're still alive with us today. And I don't know what will happen. We are monitoring this very carefully and very concerned.
The pill I have in my pocket that I'll take at 3 in the afternoon was paid for American taxpayers. It's now covered by Johnson & Johnson. They charge $500 a pill in this country. In Australia, it was 37, and the EU was 90. When the Biden administration, with us in leadership, negotiated those prices, it's now $90. So free market's great, but there's got to be some parameters to the free market. We live in a mixed market. Thank you, Mr. Chairman. I yield back.
The gentleman yields, and now I will recognize our former chairman and current chairman of the Rules Committee, Ms. Fox, for her questions.
Thank you, Mr. Chairman. Ms. Strouse, we often talk of ERISA preemption as being important for large employers to avoid the complexity of dealing with the patchwork of different insurance regulations across state lines. Why is ERISA preemption also important for small employers?
Yeah, that's a great question. Again, it comes down to being treated equally. So small employers are already at a disadvantage. So offering them plans that are regulated by ERISA, like the self-funded plans, those are just crucial. It's just another option, another opportunity for them, again, to be innovative. So we don't want regulations to get in the way when something's working, which ERISA has worked for a long time.
Thank you very much. Ms. Strouse, last Congress, the House passed the Lower Cost, More Transparency Act, which, among other things, would have required hospitals and insurance companies to publicly list the prices they charge patients. How would additional price transparency allow agents in the benefits industry like you to better assist employers and employees as they make healthcare coverage decisions?
Transparency is vital. I think we all can agree on that. And right now, the healthcare system has gotten so complicated that it makes it very hard for people to actually be able to manage their healthcare journey. And so PBMs continue to get brought up, and I will tell you, it's not only PBMs in the pharmacy space. There's quite a few stakeholders that actually impact pharmacy costs. So we need to make sure that we're not only targeting one situation and asking for them to be transparent. We need transparency across the board. So when we look at things like site-neutral payments, those are the things that we're looking at in that space as far as the hospitals and all of the consolidation that's happened in the rural communities across the country.
You know, it's intriguing to me that there is this battle not to have transparency, price transparency. Obviously, we must be on to something if the people who should be giving us transparency are not giving us transparency, because it's the right thing to do. Ms. Shields, as you mentioned in your testimony, you were responsible for setting up the association health plan for the Realtors. Can you discuss in more detail the participation in the AHP you set up? And how did this participation compare to the participation in ACA plans?
Thank you for that question. Our members were participating in the ACA. We had many that were not insured at all, and then we had many members that were getting their insurance from their spouses, if that person happened to be working. And of course, we did have some on Medicare or Medicaid. When we offered the plan, we had done many, many surveys, and this is something that was a benefit that our members had asked us to offer to them. So when we set up the plan, we didn't find that it took away necessarily from the ACA. What we found is it was a choice that our members were able to look at to see if it was a benefit for them and their family. And so we did have a lot that came to our program because they found that it was either saving them money, it was a better deductible rate for them, or they were able to have a pre-existing condition that was covered, or they were able to keep their doctors, or for any other number of reasons. The problem that we found, back to Mr. Scott's point with the ACA, was that the ones that were in there with a realtor, we were talking earlier about people that are unemployed. Well, if you know a realtor, they're going to tell you they're unemployed every day. They have to get up every day and go find their work. And with that, you might have an average price or an average income that they make, but it's not necessarily something they're going to keep year after year after year. They don't get raises like an employee does. So what happens is that their income is fluctuated. The subsidies, we were being told, is that they would take a subsidy maybe and then end up having to pay it back at the end of the year. So they don't necessarily always qualify for those subsidies. So the cost of the ACA did not always fit them with the lower cost.
Well, thank you very much. I think you've done a great job of describing that situation with realtors from ones I've talked to. Mr. Chairman, I have a question for Mr. Coleman that I'll enter into the record.
Thank you. The gentlelady yields back, and now I'll call on Mr. Kosar from Texas for his questions for 5 minutes.
Thank you. I want to focus my time today on something you won't hear much about from my Republican colleagues, and frankly, I don't think we're hearing enough about in the news, but it is what I believe is Donald Trump's most dangerous attack on the rights of working people thus far. Last Thursday night, President Trump signed an executive order that fundamentally undercuts union and labor rights that Americans have counted on for 100 years. The executive order strips the rights to organize and to bargain away from 1.5 million federal employees, and that's just where he wants to start. So for over 100 years, Americans have joined together in unions to fight to win everything from child labor laws to the minimum wage to the 40-hour work week. For over 100 years, unions have protected their members and lifted up all American workers. For more than 100 years, our unions have empowered Americans to stand up against the greedy and the ultra-rich that try to use our government to take away your money. They have stood up against people like Elon Musk who think everyone else was put on earth to just make them richer. But again, Donald Trump, at the behest of the ultra-rich, has signed this executive order robbing 1.5 million Americans of the fundamental right to come together alongside their coworkers to fight for better wages and better working conditions. And if the president is allowed to exploit a loophole in order to end the federal right to bargain, that's not where he's going to stop. He will be coming for your right to bargain and to organize next. This attack will not end with these federal workers unless we put a stop to it. But let's discuss who Donald Trump is starting with by trying to take away their rights. These federal workers are people dedicated to serving the public. Doctors at the VA, food safety inspectors at the Department of Agriculture, IRS employees who go after corporations who cheat on their taxes. This includes our janitors, food service workers, administrative employees, all losing the right to organize and bargain that workers have fought and bled for and marched for over 100 years. This executive order is illegal, full stop. Trump does not have the authority to take bargaining rights away from these workers, and it's already being challenged in court. But the president is trying to see what he can get away with after stacking the Supreme Court with not just right-wing justices, but justices picked by some of the richest people and biggest corporations in the country. This committee should be talking about this. It should really be the only thing that this committee on, quote, the workforce is discussing this week. But right now, instead, we've had kind of a business as usual committee hearing on healthcare. So let's talk about how Trump taking away collective bargaining rights impacts healthcare. Federal employees will continue to be fired without due process because they don't have union representation, and they'll lose their healthcare. CDC employees that are protecting us from the next pandemic can be fired without the security of a collective bargaining agreement. Justice Department lawyers prosecuting things like healthcare fraud can lose their jobs because they're not Trump's political lackeys, but they've lost protections in collective bargaining. These are real impacts, and we should be talking about them. So my question, Mr. Chairman, is whether we can hold a hearing on President Trump's executive order to strip bargaining rights away from 1.5 million Americans.
This hearing is about employer health care plans. We will take your question under consideration.
I appreciate that. It would be good for us to talk about, since we are the folks here that talk about education in the workforce, 1.5 million Americans losing their right to bargain. I can't think of another moment in American history where in just one day that many Americans have lost that basic labor right. So I would request that we have that hearing, if we could have it at the next meeting, or we could have a hearing about how a Trump executive order has gotten rid of the minimum wage for federal contractors, or the firing of equal employment opportunity commissioners who are tasked with stopping discrimination in employment. And so, Mr. Chairman, thank you for taking it under consideration, and I will continue to bring up this issue if we don't have a hearing on the fact that 1.5 million Americans just lost their bargaining rights. I would be interested in whether the Republican majority is trying to take away bargaining rights from even more union workers, or whether they're thinking about giving those bargaining rights back. But we know union members vote both Democratic and Republican, as they always have. And I just think it's really important for those union members to know whether the Republican majority and President Trump wants to take away their bargaining rights that they've had for over 100 years. Thank you.
The gentleman yields, and now I will, let's see. Yeah, okay. So now I'll call on Mr. Sanye for a closing statement. Yeah.
All right, I want to thank the chairman, and I really look forward to, I'm happy to work with my colleagues. Clearly, the system has worked. I think if we as people, those of us who have owned businesses, really looked at this in private, we could find a solution. We could, if we were driven by efficiency. And as I said, it's very clear. We pay the highest cost in terms of a percentage of GDP, a fifth of the US GDP, compared to the rest of the developed world, with worse outcomes, life expectancy. And that's in spite of these huge investments. We know there are inefficiencies. We know that PBMs no longer serve as any kind of efficient delivery of services. We know that taking over hospitals and closing them so that we're restricting competition doesn't help with the quality of care. If we want competition, we've got to help incentivize to have that hard infrastructure. We need to get young people to be able to go into the field. So all of those things, I really have hope. And on the Medicaid, I take my friends at their word. However, I have to say that in addition to CBO, the Kaiser Foundation did an analysis of CBO's analysis. And let me just read some of what they said. This is from Kaiser Family Foundation, a nonprofit, probably the most respected nonprofit when it comes to healthcare in the United States. And I'm proud of the fact that Henry Kaiser started in the East Bay of California as a major employer during World War II because he was really the starter of employee-based healthcare. So, Kaiser Family Foundation, quote unquote, the math is conclusive. Major cuts to Medicaid are the only way to meet the House's budget resolution requirements. The analysis goes on to say, the CBO letter confirms early expectations, finding that over the next 10 years, 93% of non-Medicare spending in the energy and commerce jurisdiction is from the federal share of Medicaid spending, $8.2 trillion out of $8.9 trillion. An additional $200 billion of federal spending comes from the Children's Health Insurance Program, CHIP. Some of the committee's remaining spending in budget neutral and therefore won't cut towards deficit reduction. Even if Energy and Commerce eliminated all non-Medicaid and CHIP spending, the committee would need to cut federal spending on Medicaid and CHIP by well over $700 billion, end quote. Mr. Chairman, I would like to ask unanimous consent to submit the Kaiser Family Foundation analysis for the record.
Without objection.
And if I could continue just briefly, in terms of efficiencies, as two people who met payrolls, if we were interested in efficiencies, I've often sat here and thought if we just, on a bipartisan level, followed the recommendations of the Inspector Generals, how much more efficient would government be? We pay for them, they're experts, they're bipartisan, they've come in with great recommendations. Yet what did this administration do as one of its first acts? It fired the Inspector Generals. Why wouldn't we just listen to them and act with the seriousness of implementing those plans? The problem is not the analysis of the IG, it's our failure to act, the Congress, on efficiencies. Elon Musk I've known for a good deal of time. 20 years ago, I was visiting the Palo Alto campus, talking to the people who ran Tesla. I thought it was a good idea. I was a Republican appointed by Governor Pete Wilson, regulator. In those days, we wanted to improve under the California waiver, the Clean Air Act signed by Richard Nixon, and then the California Clean Air Act signed by Governor Ronald Reagan. We wanted to incentivize this kind of delivery of services. The original conception and the brilliant minds behind Tesla, the computerized system and the battery, was not Elon Musk. If you want to read a good analysis of this, read Ludicrous. It's a book about how Tesla got formed. I've met with Mr. Musk. He once asked me when I was a chair of the Transportation Committee in the State Senate, he wanted to know why in California we couldn't be like Oregon and not have a sales tax on cars that cost $100,000 so we could get more of it out. At the time, I was chair of the Budget Committee on Health and Human Services. During the recession, we were cutting our social safety net by billions of dollars, Democrats, with Republicans. I told them, it's a funny exchange, I said, I can't comprehend of writing a bill like that. So I've had a long relationships off and on with the company. The plant is, many of the people who work in Fremont live in my district. I've been there multiple times. There is a genius, I suppose, to what's happening there, but you have to look under the hood, so to speak, to the corporate culture. And the corporate culture doesn't work. The companies that are coming online internationally, Ford, GM, who are providing that product, are doing it in a competitive way. They were late, and I wish they had been earlier. But in terms of efficiency, just because somebody has a lot of money doesn't mean they are the messenger of efficiency, particularly when you're coming from a business model like that to a completely different model. And I am completely committed to working with my colleagues to look at efficiencies. There's no excuse for the federal government to have inefficient delivery of services. So with that, Mr. Chairman, for all of our differences, for you and the chairman of the full committee, and it's in our best interest to respect one another, and I know we do, even when we get heated about some of these things. But I think we can fix this system in this subcommittee if we take that approach. And the cuts to Medicaid, putting it in the budget where responsibility goes, eventually, inevitably, since you're in the majority, what the final numbers are, I will respect that division. But I think it's completely accurate for us to bring the subject up aggressively because it's in the budget. Thank you, Mr. Chairman, and I yield back.
I thank the ranking member, and again, I agree with Chairman Wahlberg. I can't wait to shine a light on it and show the people of this country where the money's going. You know, I served on the Healthy Future Task Force, and I asked all the experts to give me a breakdown of where every healthcare dollar is going. They couldn't give it to me. You know, we talked about how complex healthcare is. They couldn't give it to me. We spend $4 trillion in this country on healthcare. And if you think about what Elon Musk said, he said, we're sending money out that we don't know, that there's no characterization on it. It's what he calls it. I call it code. Okay, what's this for? And I'm talking about, here we talk about B's and T's, not millions. I'm talking about billions. And also, who actually approved this or appropriated this to be spent? Maybe that's the reason the inspector generals got fired. Maybe they weren't, doing their job. I mean, we're all seeing the list of waste, fraud, and abuse that's coming out of this exercise. We should be embarrassed about it, not defend it. I mean, why a public company wouldn't get away with this? Their shareholders aren't the taxpayers shareholders in the federal government? They've got stock. They got ownership. That's the reason they pay taxes, is to be secure and to make sure that their dollars are being spent in a wise way, which is frankly the only way we're going to survive. Like I said earlier, we're running $2 trillion deficits after COVID. If we were at pre-COVID spending today, we would have a balanced budget. Because like CBO said, revenues would not increase under our Tax and Jobs Act. Well, revenues are up $1 trillion. You grow the economy, you grow revenues. You grow GDP, you grow revenues. Folks, there's a way to do this, and there's a way not to do it, and somehow we've got to convince each other that, okay, this is how you get the job done. And I'm looking forward to that. I really am. We've learned a lot today. One thing is small businesses need flexibility and as many tools as possible to combat years of rising health care costs, to continue to offer high-quality and affordable health care benefits to their employees. A former president promised the American people, if we pass this, your premiums are going to go down. What happened? There should be alarm about that. And we're just sitting here paying the bill. And guess who is paying the bill? Our children and our grandchildren and future generations. We should be ashamed of that. Democrats and Republicans share the goal of expanding access to affordable and high-quality health care to all Americans. And there's a way to do it. As we heard from our witnesses, doubling down on big government health care is the wrong approach because it takes away choices and increases health care costs for employers and employees. The government is not the answer. The people are the answer. We give this to the people, they'll fix it. I look forward to continuing to work with all members of the committee on the innovative free market care solutions we discussed today. And with that, this hearing is adjourned.